Hello, everyone. Welcome. I'm really excited today to be joined by Marion and Taylor. Marion is Assistant Vice President of Data and Advocacy at Planned Parenthood Advocates of Ohio, and Taylor is the Organizing and Field Director. And we're going to get into all the important moments of what's been going on this whole year, which, I guess is a couple weeks old, but really I'm thinking about the first Trump administration and everything that we've been facing down. For those of us who do work in advocacy and organizing, the three of us, I was thinking about it, have like almost a combined 4 decades of organizing and field and campaign work, both here in Ohio and I know other states. And this work is harder now. It's always been hard. It's been especially hard here in Ohio for reproductive freedom, but it's, we can't forget what's happening in our country right now, and the fact that we have a fascist government taking over, where we see that our tax dollars have gone to pay for ICE agents who are violently oppressing people in the streets and in their homes. And all of that money came from our healthcare, our access to healthcare. There was money to make healthcare more affordable, both through Medicaid and through the Affordable Care Act. And that money has been disappearing. One of the big ways was defunding Planned Parenthood from being able to get Medicaid reimbursement. So we had in the big, terrible bill that I know we've talked about before, but that defunding here in Ohio took $8 million from our ability to serve our patients. That led to 2 health centers being closed, and in just Planned Parenthood of Greater Ohio's region, we know that there were also 2 health centers closed in the Southwest Ohio region. So we've seen real impact immediately for our communities, and both for our staff and in the reductions in force that we've had to have, and in our direct ability to provide care. So we're in a horrible landscape of trying to provide important, necessary health care, to advocate for our patients' right to have that health care. And we're also a part of a greater movement that is fighting for our humanity and the humanity of our neighbors. And I know for me, the biggest question I get all the time is like, is what we're doing, does it matter? Like, is there anything that we can really do to make a difference in this overwhelming attack and this very clear authoritarian takeover? And I'll say the answer that I think is best is that there isn't one way that we're going to win, that we're going to, there isn't one tactic or one strategy that's going to get us ultimately to the other side. It's going to be a diverse group of people, a diverse group of strategies coming together. And that's what we're trying to provide here. And I know that's really what we're going to dig into today. So I want to really kick it to you, Taylor, to introduce the Care Continues events and why care as an organizing strategy is so important. And then we're just going to get into it from here, because we know all of our listeners are ready to jump in and take greater action. And we're ready to do that with you.
Thank you so much, Lauren. Like you said, we are in a state of crisis when it comes to our healthcare, when it comes to folks having access to Planned Parenthood, as they always have. I remember when I was in high school, when my local Planned Parenthood was closed before I ever got the opportunity to take advantage of it. So this is definitely a trend that we've been seeing over many years now, but has just been absolutely exacerbated by losing our patients being able to use their Medicaid at our health centers. And so to meet this moment, we're really trying to do multiple things at once, and we definitely know how to walk and chew gum at the same time. So the purpose of this campaign is twofold. One, we want to make sure that folks are aware that they can still access care with us and how they can do so, and that their needs will be met during these extremely challenging times. So part of these Care Continues forums is definitely making sure that folks feel reassured and know how to navigate this challenging healthcare landscape, but also by bringing in local partners that are doing work on the ground, providing mutual aid and direct assistance to folks that are being directly impacted by the healthcare crisis, but also the abundance of different like crises and issues that folks are facing every day in our communities. And so we definitely want to let folks know how we've been impacted, but reassure them that like of all the ways that we are finding to be able to go on. But also a huge part of this is education as well. Now, before there is another opportunity to defund us round two, we really need to make sure our message is urgent, that we cannot afford to lose out on another year of our patients not being able to use Medicaid at our health centers. And so with that comes a lot of education and awareness, making sure our active folks are educated and aware, but also by bringing in new people as well. So I'll talk a little bit more about the care forums in a second, but part of this campaign is going to be phone banking to call Planned Parenthood supporters and likely supporters to, one, make sure that they're aware that we've been defunded and what that means for Ohioans, but then offer them to take an action by inviting them to our Care Continues forums that we're hosting in Columbus and Cleveland. So at these forums is kind of like our centralized point where we're trying to host a resource fair for those local organizations that I mentioned that are doing on the ground work to make sure that folks know of the variety of support that is available to them and can also leave with tangible items as well. We also really want to hear about what are the issues or barriers that folks are facing every day that's most pressing to them. We'll be doing this by soliciting feedback from a survey, as well as facilitating small group discussions so that folks can go into more deeply what is most important to them and how they want to get organized.
So these Care Continues, it's a campaign and it's an event. So this is an event that our supporters can attend, and other partners are going to be there. Who are the partners that are going to be there? I know you mentioned that there are other partners.
For Columbus, some of the folks that will be joining us are Abortion Forward, the Black Queer Intersectional Collaborative, Mass Ohio, which I think is mutual aid. And also we'll have folks from Zora's House. There's going to be folks from an Ohio State program called Moms to Be. So really just like a plethora of resources that may cover a variety of information that people are looking for or ways to get connected to direct support.
Marion, so it sounds like, you know, we're talking about advocacy, but we're talking about care and meeting people where they are. What is the strategy in making care a campaign?
The strategy is, centering the communities that we serve and ensuring that we're creating space to also meet people who we know care about our issues, are being negatively impacted by this administration, and finding ways to meet them where they are and create space to bring them into this work. One thing that we definitely recognize is that we're not going to win this by just, relying on the networks that we currently have. We always have to make sure that we are bringing new people into the movement. And so this is an opportunity for us to meet people who maybe haven't had an opportunity or don't to join us or don't know where to get started, and bring them into this work.
So this is an event that you can attend even if you've never attended a Planned Parenthood organizing event before.
Correct. We are working with some partners that we haven't partnered with before. We're also using some strategies and tactics to help reach people that we have not engaged with before, to bring them out and get them involved.
Taylor, what actions are going to be happening at the Care Continues events?
Yeah, I am super happy to. And just to piggyback off of what Marion was saying, like, if folks' basic needs are not being met, it's really hard for them to get involved, which is kind of at the core of these events. So, in addition to making these events accessible, and if folks haven't come before they can, folks can also bring their children. And while we will not be providing childcare, there will be like child-friendly activities. So we don't want that to be something that keeps folks from coming out. They're more than welcome to bring their kids as well. Part of what we call the cycle of organizing is that we begin with taking care of folks as a point of access. One of the ways that we'll be doing this, both at the Care Continues forums, as well at a couple of our PP Generation Action College campuses, are making and assembling these different care kits. These kits may include can be like separate and specific. So things like menstrual care kits, safer sex kits, or gender affirming care kits, anything that makes folks' lives a little bit more comfortable or easier. We want to make sure that we're getting those things into folks' hands. And a way that we do this is we're going to come together to pack these items. Folks are certainly free to take whatever kits that they need home for themselves. Anything that's left over, we will work with local distribution partners or our local health centers to make sure that those kits get into the hands of folks that will utilize them. And same thing for our college campuses. We'll be training those folks on how to run these packing parties on their campuses, and then they'll be focusing on peer-to-peer distribution. And whenever we are providing care, it also presents an opportunity for us to talk about, why are we doing this? Why is it necessary that we come together to pack and distribute these items, and start having those conversations about what are the underlying things that are causing people's needs to not be met, and use that as a conversation and a starting point to talk about how we can make sure people are taken care of now in this moment, while we work towards building longer impacting policy change so that folks' needs are automatically being met and that they don't have to seek out those items for themselves.
I think the most important piece that I'm hearing, both for these events and our ongoing advocacy strategy, has to do with building relationships, like building the connections to other partners who are also serving community, and building relationships with people who share our values, who recognize that change needs to happen and that we need to show up, but we're all showing up in different ways, and that's okay. And like, this is a really good stepping off point. I'm hearing the word build a lot, and building relationships, especially as a strategy for getting us through this time now and for really succeeding in the future, for, building the state and the country that we all deserve. What is it about building relationships that's so necessary right now and as part of our winning strategy, Marion?
Building relationship and being in relationship with the communities that we serve is really at the core of our theory of change at Planned Parenthood. And so we have a number of different programs, constituency-centered programs alongside our patient advocacy programs. Those constituency programs include our Black organizing program, our PP Generation Action program, which centers young communities and more specifically focuses on college and university students. And then we have our Raíz program, which is our Latina community-centered organizing program. And I would say the really important things when it comes to building relationships and the reasons why we have these different constituency programs is that it is really important to make sure that we're centering the voices and the lived experiences of the communities that we serve and that we are being in community with. Really specifically with our RISE program, we have been doing a lot of amazing work. Our RISE program manager has been doing a lot of really great work centering the Latinx community in our organizing efforts and building relationships, also hosting community care, kit packing events, as well as hosting an annual community baby shower. And this just allows for us to bring more people into the movement, help spread more awareness about what is going on, and educating communities about the work that we're doing.
A community baby shower, that sounds really fun. Can you share more about that event?
Yeah, absolutely. The community baby shower has become an annual event where we work with different community partners across the greater Cleveland area, where we receive donations both from partners as well as the folks in the community to then assemble kind of like care kits, but for new parents. And so we've collected things like baby seats, diapers, wipes, a lot of different resources that are really helpful for new parents in the community. And then we have an event where folks can come and pick up kits, learn about the different organizations that help to put on the baby shower. And yeah, it's another way that we care for our community.
Is there an element in these events, Taylor, that includes storytelling? How do we connect person to person in a impactful way?
Yeah, I'm really glad that you asked. As Marion had said, the core of this program and also our overall organizing strategy is centering and uplifting those that are being most impacted. And in addition to that, it's how we humanize and put a face to the issues that we're fighting for. So part of these Care Continue forums in both Columbus and Cleveland is hearing from folks that have been impacted either by the not being able to use their Medicaid, or if they have been a previous patient of Planned Parenthood and they know more than anyone how valuable our services that we provide are. We really want to hear from those folks. And in addition to that, it helps folks think about other ways that they have personal connections to this work, and why their voice in turn also matters just as much for this movement. So we definitely want to have an opportunity to hear from folks, and hopefully in turn, it inspires more folks to want to share in the future.
Absolutely. I know we are always collecting stories to connect to our lawmakers that are still, unfortunately, here in Ohio, always trying to strip away access to healthcare. But we know, for the few champions that we have, and for the champions that we promised to get elected in this year, that hearing the stories directly from their constituents and the folks living in their communities is also so important. Can you share more about the volunteer pipeline, like how folks can start by coming to an event and hopefully meet their people, find what they're good at, and how else they can support in this movement?
Yeah, I would absolutely love to. And if I may, I would love to share a short anecdote about how I got involved and where I am now. I was myself a student when Trump first got elected. It was my first ever election I participated in. It was my first year being in college. And I remember feeling incredibly hopeless and wanting to do something, but I literally had no idea to do what. I grew up in a pretty rural area. wasn't super politically active, engaged until Trump captured my attention in the worst way possible. And then I was hyper tuned in. I remember going to an event that a Planned Parenthood organizer was participating in at the Ohio State Women's Center. And at the time, a friend who had previously volunteered and I would just go to any women's center events that they were hosting around reproductive rights and healthcare. And after sitting and listening to this Planned Parenthood organizer speak on a panel about the global gag rule, my friend and I went up to her and we're like, what do we do? How do we get involved? And I think one of the most valuable things that she did was she connected me with other students who had recently also come up to her on campus and said the same thing. And that's also why relationships are so important, because from there we were able to reestablish the Ohio State Planned Parenthood Generation Action Chapter that still lives on today. And so it's really important that folks have opportunities to learn, but also, as we keep going back to, get connected to like-minded folks, that we don't expect everyone to have all the answers, but we want to be like facilitators in identifying those solutions. And so getting folks connected to the information, the resources they need, and the people in their community that are also ready to take action is so important. And so for me, that journey began 9 years ago, and I've been involved in this work since. It's a little wild, the deja vu that I've been experiencing in some ways with the second Trump administration. But I think that's why it's so important for events to be accessible, because I know like having something that was local to me that I was able to go to and an opportunity to chat with others and get more deeply connected was, not to be dramatic, but it was life altering. I started as a biology student and I graduated with a political science degree. So it was incredibly impactful. And part of why I love this work is because I want to create opportunities for other folks to be able to find their people, to find their niche, and to feel like they're making a difference in an incredibly challenging time.
Absolutely. Thank you for sharing your story, Taylor. We have very similar stories. I know we've shared before. So it's important that we continue to work with young people, especially, but you're never too young or too old to get involved. And we're really excited for our expanding opportunities. Marion, I know you've talked about our constituency programs. Can you share more about the importance of meeting people where they are and how people can show up differently in this work, and the other opportunities we have and the strategies behind it?
Yeah. The communities that we serve are in a monolith. And so that's why it's really important to ensure that we have, it's part of meeting people where they are. Making sure that we have different types of opportunities to, some opportunities for introverts, some for extroverts, and of course, that we engage in the different communities that we work with, using tactics that are culturally rooted or make sense for that community. And so, for example, some of the different opportunities and ways that we bring volunteers in this work. Of course, we have storytelling is a huge opportunity that we have for volunteers. A lot of volunteers enjoy tabling. I know Taylor just shared, the way that she got involved was through PPGen. A really big opportunity that has really, I would say, really sparked a lot of interest, and is part of the reason for this campaign, is our community care kits. This is a real opportunity for us to cater to the community's needs. And so we have an opportunity to build different types of kits. In the beginning, we started with abortion care packages, creating packages for right after Roe fell in what was that, 2022 now? Um, and from there, we saw this huge interest in mutual aid type of work. And so we continued by building out our own care kit program. And so something that we're excited to be doing this year is building different types of kits, like gender affirming care kits. I already talked about the community baby shower, so like kits for new parents. And the opportunities can really just go from there.
Absolutely. And I know everybody takes action at these events too. This is an opportunity to let Senators John Husted and Bernie Moreno know that Ohioans do not want Planned Parenthood to be defunded, that they don't want money going to ICE agents that are violently oppressing people, but that like money should be going to healthcare. They've made this decision. Like what we're seeing right now, they have control over. And the same calls have helped us mitigate really terrible legislation here at the State House. But I know as part of Care Continues, we're going to be fighting against what we see as funding for the Department of Homeland Security, which is it's not security. And for healthcare, that money should go back to the community, and we should be seeing it here in Ohio and across the country. So we really want to see our current supporters at the Care Continues, starting with the Columbus event on February 18th. You can join us in March in Cleveland. And if you aren't hearing the city or community that you live in, but you're interested in hosting Care Continues, I know that we can be in touch with you directly and help organize a volunteer event closer to home. So please let us know if you're interested, but especially click the link below so that you can join the Care Continues campaign, whether that's donating supplies, donating your time, showing up to meet everybody in your community who's also showing up, and making those calls to our senators who are making, they want to hide behind Trump, but they have a say in what's happening right now, and they absolutely should be speaking up for their constituents.
Also, if folks are interested in hosting their own packing parties and what that looks like, it is a super friendly way to get a group of folks together, bring your own items, and pack those kits in your own neighborhood and identify different places where you think those resources could be best distributed. So I think the way we make things the most accessible is by having folks that want to take the lead and host these things in their own neighborhoods. So I'm really glad that you mentioned that, Lauren, because even something that seems like a small act, even identifying who in your neighborhood cares enough to do something like this and building a relationship with those folks is also how we build long-term power, not from the top down, but from at the grassroots and at the neighborhood roots level.
Marion, Taylor, why should folks show up on February 18th?
So your voice and your story matter. When you walk into the Care Continues forum, you're stepping into a space where you'll be seen, heard, and valued for exactly who you are. These conversations only work because people like you bring lived experiences, your questions, and your hopes into the room. The stakes are real right now. Communities across Ohio are feeling the impact of the ongoing defunding efforts, health center closures, ICE across our communities. And this is why we need everyone. Showing up isn't just attending an event, it's taking your first step into a community that is organizing, building power, and refusing to let these attacks go unanswered. If you're wondering how to get involved or where to start, this is your entry point into fighting back.
To echo what Marion said, is part of the tactics of this administration is to make us feel isolated, hopeless, and alone. And we really want to combat that during these events. This will be a welcoming space with like-minded others and organizations that are here to get connected with and to support you. And showing up and getting involved in any way you can is how we build power together, and how we will take care of ourselves in the absence of like the powers that be not doing what they should, actively making folks' lives harder. We will take care of ourselves, and make sure that we have each other. And so this is a space for folks to be able to do that and to get connected with others that are feeling the same way that they are.
Absolutely. Join us in this fight. Join us to make sure care continues. We're going to show up for each other. We're going to show up for ourselves. February 18th in Columbus. We'll join as soon as you sign on to the link. We'll send you the Cleveland March date if that is better for you, and let us know you're interested in volunteering. Please join us on the 18th. Keep up the good fight.
Thanks for listening. It's going to take all of us for autonomy to rise. So like, subscribe, and share. Support our work by donating to Planned Parenthood Advocates of Ohio. Visit us at plannedparenthoodaction.org. And don't forget to text CARE, C-A-R-E, to 22422 to protect Medicaid and Planned Parenthood for all.